you know your patient has diabetes, remember the index? You know that we're so used to using our phones. You can go back to the index and find diabetes mellitus, and you can look that up and figure out where there is a care plan for that particular patient in that, and use this book as a reference, okay? There's also Quick Plan Locator, very back page. I don't know, it has a list. And with this book, you have online resources that you can go and pull other care plans out of. So if it has a little thing that says E on it, okay, then that is an Evolve care plan that you can actually go and download those resources with your textbook, okay? And this is how you're going to learn, how we're going to teach you to be a nurse, how we're going to teach you to plan that care, okay? So this book is a valuable resource. You're going to need it in clinical. You're going to need it, when you're working on your care plans and things like that. So that's the whole purpose, is to teach you to use this today, to teach you to develop that plan of care, okay? So if I flip over to page 3, we are still in chapter 17. We talked about the different types of diagnoses. When we have a nursing diagnosis, what is a nursing diagnosis versus a medical diagnosis? Anybody know? What's nursing versus medical? Give me a medical diagnosis.
It's like the actual disease.
Like somebody has diabetes, that's medical, right? Okay, so think about nursing. How would we phrase that in nursing? Because you need to get out of your heads. We are nursing model, so we know disease process because they make us take pathophys, but we have to think of it. So somebody with diabetes, what would be their problem? High blood sugar. So high blood sugar would be a problem, right? So when we look at a nursing diagnosis, if you start skimming through here, you're going to see labels: impaired swallowing, non-compliance, nausea. And it is things that we as nurses, as registered nurses, can help to try to modify with our patients, okay? So we need to be thinking, when we're looking at these, it's what I as a nurse can do. And some students, as we get into this, I will still get care plans and they'll put, as a nursing diagnosis, diabetes. I'm going to give that back and say, no, it's not diabetes. Remember, we can't use that medical diagnosis. So when we look at nursing diagnosis, you need to get used to, and I'm going to show you, work with you on how to write these statements. So we have a problem statement, which is going to be our nursing diagnosis label. So when I look in here, my labels, like here's one, that's not it. This is disease specific. Some of them are a non-compliance. I hate that word, but that would be a nursing diagnosis label, okay? Then our second part of the statement is our etiology. Okay. I'm hearing myself, guys. I'm sorry, I thought somebody was talking to me. So our second statement is our etiology, or our related to factor. Okay. What is an etiology? Cause. Guess what? You guys take patho for, huh? So etiology is kind of your pathophysiology of what's happening. So when we write a nursing diagnosis statement, we'll say like non-compliance related to knowledge deficit, or inability or reduced access to resources, okay? As evidenced by, we're looking our PES statement. Then our last part of that statement, it's a 3-part statement, is our signs and symptoms, especially if it is a problem statement, okay? So, patient's non-compliant related to reduced resources or reduced income, as evidenced by inability to purchase essential medications to reduce blood pressure, or essential, you see what I mean? So we're going to, so don't fret. You're like, oh no, how am I going to write this? We're going to work through writing these statements to get you used to that, okay? So, we have the 3-part statement: problem, etiology, signs, and symptoms. One thing to remember, cut that down a little bit. If it is a risk 4 nursing diagnosis, it's a 2-part statement. We don't have signs and symptoms with risk 4. Remember, what's a risk 4 nursing diagnosis? We're going to have what? Risk factors with that. Okay? So, your etiology, going back to that etiology, what did I say? That's your patho. It can't be a medical diagnosis. Why can't it be a medical diagnosis? Why did I say? We're not nurses. We're not doctors. It is what we can modify. Okay? All right, is this making sense? Starting to getting a little, the waters are clearing a little bit. All right? And so what we're going to do is we're going to move on to the case study activity. And the first part of